The doctor felt little more than a faint qualm for the future, a vague unease. Everybody knew that pestilences have a way of recurring in the world, yet somehow we found it hard to believe in ones that crash down on our heads from a blue sky. In this respect, we wrapped up in ourselves and presupposed that pestilences were impossible. The doctor acquired somewhat more imaginations than the average. They record that some 30 or so great plagues known to history had accounted for nearly 100 million lives. The doctor put themselves up sharply. They were letting their imaginations play pranks. A few cases, they told themselves, don't make an epidemic. They merely call for serious precautions, and the dangers still remain fantastically unreal. The doctor took a close look at the patient. They noticed almost all the common symptoms, such as fever, dry cough, and nausea. However, the doctor and the patient both knew that the breathing difficulty was the most distressing sign. After a moment, the doctor gave a slight nod, as if approving of some thoughts that had crossed their mind. Once the epidemic was diagnosed, the patients had to be evacuated. Their family might not be seeing them again until they were dead.
Have some pity, doctor.
An unnecessary appeal. Of course they had pity, but what purpose could it serve? On their way to an infected house, the plague doctor saw a dead body lying in a blind alley. The parish had not appointed anybody to bury it, but only set a watch there that nobody should go thither or come thence, which is the most cruel thing. The plague that happened in 1665 made us more cruel to one another than if we are dogs. The plague doctor protected himself by means of leather, with large crystal glasses and a long snout containing aromatic spices, employing also a wand with which to issue instructions. Helpless to alleviate the plague, they performed the medical visit only because they dared not stay away for fear of infamy. The doctor noticed the patient was mortally infected, as indicated by the carbuncles and pus. Unfortunately, they could not cure them, as was frequently the case. Each day, heaps of dead bodies lying unburied. Each night, the death carts would empty dozens of corpses into the earth. Cartloads of dead bodies rumbling through the city's grew haunted darkness, nights and days filled always, everywhere, with the eternal cry of human pain.